intelligent guys, but they don't seem to give the same amount of importance that we give to our finances or our personal development or our health. So health does require a separate amount of concentration from all of us, right? So master health checkups are the reasonable way to find out whether there's something going on with us. And I would suggest everybody above the age of 50 gets a master health checkup once a year. Once a year we dedicate it for our health. And then any hospital, any good hospital will do a reasonably good master health checkup. And I would only suggest that we add this PSA prostate specific antigen blood test to the master health checkup. That's important for us to do, right? So not only the master health checkup, a lot of people neglect symptoms. And the single most common symptom that they seem to neglect is blood in the urine. Right? Blood in the urine is mandatory to get checked by a urologist. If we don't do that, then we are missing out potential trouble inside the genitourinary system. So the blood to வந்துச்சு அப்படின்னா நம்ம ஊர்ல காமனா சூடு அப்படின்றாங்க. It is not சூடு. It is not that. யார் சொன்னா எதிர்விட்டு மாறி சொன்னாங்க. That is not correct. You have to come and meet a urologist. Blood வந்ததுன்னா எதனால வந்தது, எங்கேருந்து வந்தது. Mandatory for us to have a look at it. So if there's one thing I want you to take away from this meeting is, if there is blood in the urine, make sure you visit a doctor and find out where it's coming from and why it's coming, and get a master health checkup once every year. That's important, right? The other thing that I want to talk about is this, we've all spoken about prostate cancer, but we also need to speak about benign hyperplasia cancer. So if somebody comes to us with symptoms of prostate trouble, like அடிக்கடி போகுது, விட்டு விட்டு போகுது, burning இருக்கு, or speed வரமாட்டது, இதெல்லாம் can potentially mean there is trouble with the prostate. So what sort of trouble? A small percentage of cancer இருக்கும், but பெரும்பாலும் majority of people will have big prostates or prostate that's obstructing, அடைக்குது, பாதை அடைக்குது அப்படிங்கிறது அர்த்தம். ஸோ இப்போ அதுக்கு ஒரு புது ட்ரீட்மெண்ட் வந்திருக்கு. So previously we were all giving medications for that. What sort of medication? One that will relax your passage, other that will reduce the size of the prostate. அதில் கேட்கல அப்படின்னா சர்ஜரி போயிடும். இப்போ there is a new treatment that is halfway between surgery and medication. So medicine வேலை செய்யலன்னா இப்போ Rezum அப்படின்றது இருக்கு, which is water vapor therapy or நீராவி. All of you know steam is a water vapor, right? What we do is put small needle, you see this video, small needle in the prostate, and then it puts steam inside the prostate. And what happens, steam is supravital to tissue. The tissue will not survive when you put steam. Adhe mari we do it within the prostate. You see that video, a small needle goes inside, small cystoscope, and the steam reduces that tissue over a period of time. So this surgery is tissue editorno, odane urine nalla pogum. Ida pannone it takes about a week, 2 weeks for you to get the full benefit. So after a period of time, the prostate starts shrinking. Right? Advantage, tissue only editor. So it's not surgery. We don't take out things. Right? We just reduce the size of the prostate and increase the channel. So this is something that's new, that's come up, and I think it's, surgery na bio. So there is a treatment that's not surgery that's available, that's come recently to our part of the world. So that's something we need to know. And then before we finish, I must thank our patients who believed in us, who trusted in us, and continue to trust us. So without them, we are nowhere. Right? Thank you for trusting us over the years. And like I said, this journey is never a single man's effort. It can never be a single man's effort. And I have to thank my team. It's a fantastic team, and I'm really proud to have all of them now over the years we've learned to trust each other, we've learned to, we don't even speak to each other in the operating room now. What I need gets done immediately. The anesthetist, the nurses, the techs in the theater, it's just seamless and smooth, so I must really thank